Hi, my name is Debbie and I'm the OB Navigator here at West Boca. Welcome to the Boca Center for Women's Care. Today, I'm going to bring you in to our unit and show you what it's like to be a patient here, whether it be in our triage or our labor and delivery. Our hospital is conveniently located off of 441 in between Palmetto Park Road and Glades Road. You will take the entrance for the Boca Center for Women's Care, and we have a circular drive where your significant other can pull the car right on up to our doors, which are opened 24/7. So any time of the day or night, this is the entrance that you use, whether you're in labor or you're coming here for a problem to be addressed. We have security that will greet you right behind those doors, and then your significant other can park in the parking lot directly behind our circular drive. So the wonderful aspect about our unit is everything is housed on one floor. Here on the first floor, we have our labor and delivery, we have an antepartum unit, we have a triage, we have 2 operating rooms, a recovery room, our mother-baby unit, and our NICU, all housed together on this first floor with our own private entrance. That's especially nice because the only people coming in and out of our unit are people like yourselves having babies or people like me that work here. So when you come into the triage, we may or may not have you put a patient gown on. We may or may not get a urine specimen from you, but we put all of our mommies on the fetal monitor. We also put you into our computer system. We're going to ask you medical history. We're going to ask you what pregnancy this is, when your due date is, if you have any allergies. And when we put you on the fetal monitor, this is what we're going to see. This is a 10-minute strip of your baby's heartbeat. This dark gray zone is considered normal. So anywhere in that tracing, sometimes babies go up a little higher, some go a little lower. Your baby is running right around 130 beats per minute, which is totally normal. And we have these nice accelerations up to about 160 and then back to your baseline. It lets me know that your baby is doing well inside the belly, okay? The purple line, that's your heart rate. And the bottom line here, those little mountains are your contractions. So whether you feel those or not, you're having that little tightening. And they look like they're about every 2 to 3 minutes apart. We are also going to have you sign a consent if we do need to do a vaginal exam, if one of the nurses need to do it, or your practitioner. You may or may not have a biophysical profile or an ultrasound while you're here in triage. And the stay could be anywhere from 30 minutes to a couple of hours, depending on the amount of procedures that we do. If we send you home, I'm going to send you home with verbal instructions and a piece of paper that is written instructions for you to keep as a guide. Things like regular contractions, if your water breaks, if you have any vaginal bleeding, if you have a temperature, any headache, blurred vision, spots before your eyes, pain in your belly, all reasons to call your doctor and return to the hospital. So once we bring you into one of our labor rooms from the triage, we're going to put you back in bed, put you on our fetal monitor, which is going to monitor your baby's heartbeat and your contractions. We're also going to ask you some questions about your medical history. We're then going to have you sign some consents, and we're going to have you fill out one of our preference sheets. Things like if you'd like your baby to go skin to skin as soon as possible, if you'd like the baby to go to the breast as soon as possible, if you'd like your significant other to cut the cord, and if you'd like to have delayed cord clamping. All things so that we could hopefully have you let you have the delivery that you desire, and so that we can be on the same page. We will also be starting an IV on you, give you a little IV hydration, and get some lab work. There are 3 stages of labor. The first stage begins with the onset of your labor and ends when you are 10 centimeters. Early labor is considered 0 to 6 centimeters. The active phase is 6 to 8 centimeters, and transition is 8 to 10 centimeters. The second stage of labor is when you start pushing until you deliver your baby. The third stage is after your baby is delivered until the delivery of the placenta, which can take anywhere from 5 minutes to 1 hour. During this time, you can go skin to skin with your baby. Delayed cord clamping can be done. If you're doing cord blood collection, we also do it at this time. There's different types of pain management that you can use for your labor. Some of our moms use breathing techniques. Some utilize our cub chair, our birthing ball, and our peanut balls. These are all available to you, sometimes used in the early stages of labor, so mom can get out of bed, move around a little bit, have a little bit more flexibility. Some of our rooms offer wireless monitoring, and this helps you get up and ambulate if you have to be monitored during your labor. We also have some prearranged water tubs that you can make arrangements for. It is for hydrotherapy for your labor. All of the information is on our website. There is also some IV pain medication that your doctor can order for you. This kind of takes the bite out of the contractions and helps you cope a little bit with your labor. Nitrous oxide, which is a gas that can be used during your labor, is also another option. There is then the epidural that is placed by one of our anesthesiologists. Once the epidural is placed, then you are bedbound. We help you after you deliver, get up to the bathroom after you have recovered. Induction of labor or augmentation. Your doctor may choose to induce your labor for medical indications. That may be if you have elevated blood pressure, if you're post-dates, that means after your delivery, estimated delivery date, if you are advanced maternal age, or if there's known implications with your baby. Some of the medications that we use, Cervidil is to ripen your cervix. It's a flat tampon that is inserted into the vagina and left for 12 hours, and that helps to soften and ripen your cervix and makes it more favorable for the induction of labor. There is also Cytotec, which is a little portion of a pill that is placed inside the vagina every 4 hours, and intermittently we will monitor you, get you up ambulating when this type of medication is used. Pitocin is another induction agent that is placed on an IV, it's put on a pump, and it's regulated to have your contractions come every 2 to 3 minutes and help open your cervix. They can also rupture your membranes or break your bag of water. This sometimes can happen as a form of induction, and sometimes your bag of water will break on its own. If it does break on its own and you are at home, it is very important to note the time, the color, and the odor of the fluid. There is also something called a Foley induction that your physician might order for you. And these are all mechanisms to help induce your labor. During the delivery itself, your doctor may choose at the time of delivery to cut an episiotomy, or you may have a laceration at the time of delivery. This just helps kind of expedite the baby to be delivered vaginally. Once you are recovered and we get you up to the bathroom for the first time, we are going to show you how to take care of your bottom area. Now, C-sections are sometimes unscheduled if your labor doesn't progress or there's an issue with your baby's heartbeat. Some of our C-sections are scheduled prior to you coming into the hospital, whether the baby is breech or you have a placenta previa, or you are a repeat C-section, and those are scheduled in advance where we have you come to the hospital prior to your admission, go over pre-op testing with you, and let you know when you need to come to the hospital. Now, if you have a C-section or a vaginal delivery, you will be here in the labor and delivery area for at least 2 hours for the recovery process. During that time, we do vital signs on you and on the baby. We check your fundus area, we check your bleeding, your pain management, and then after that 2 hours is ended, we move all 3 of you, baby, mom, and significant other, to our mother-baby unit where you spend the remainder of your time here at West Boca. Recovery is 2 hours while you're here in labor and delivery. During that time, we check your vital signs every 15 minutes along with fundal checks, and we assess your bleeding. In about an hour, if you've had a vaginal delivery, we can feed you. We help you get up to the bathroom. As long as all your feeling is back in your legs, if you've had an epidural, we will assist you to the bathroom and get you cleaned up. And then after the 2 hours of recovery, we will move all 3 of you over to our mother-baby unit, and that's where you will spend the remainder of your time here at West Boca. I want to just explain to you that this is our infant warmer. So this provides warmth for your baby, and we also weigh your baby here. Once you've gone skin to skin or maybe to the breast, we're going to place your baby underneath the radiant warmer, and we're going to put 2 bands on your baby. One on your baby's arm, one on your baby's leg. We're also going to give one to mom and one to your significant other. This identifies you with your baby, kind of like a claim ticket. We're also going to put a security tag on your baby's umbilical cord. This is like a little baby low jack. Here at West Boca, we have a lot of locked doors for security reasons. If someone were to try to get your baby a little too close to one of those doors, our alarm system goes off. So it's just added security for you and for your baby. Here at West Boca, we offer the highest level of care for your baby. We are a level 3 NICU. What that means is that our neonatologists, they sleep in house. So they're here 24/7 in the event that your baby would need that specialized care. With that being said, we hope you never need our services. However, if that does happen, rest assured that your baby is in good hands. Our babies here at West Boca, if they do not need to go to our neonatal intensive care unit, room in 24/7. So everything is done at the bedside. We transition our babies at the bedside, pediatricians check the baby at the bedside, all the lab work, vital signs, bath, everything is done right beside you. So once your recovery time is complete over on labor and delivery, we're going to move you, your baby, and your significant other to our mother-baby unit. And this is where you're going to spend the remainder of your time here at West Boca. All of our rooms here on the mother-baby unit are all private, with private bathrooms and private showers in your room. So you'll never be sharing with anyone except each other. Some of our rooms have 1 bed, a pull-out couch or fold-up bed for your significant other, and some of our rooms have 2 beds. So if you have a preference, you can always ask your nurse over in labor and delivery, and we will try to accommodate you. Once you get moved to the mother-baby unit, we're going to have a little snack pack, a little goodie box for you to snack on after your delivery. And then the following morning, we will have a celebration breakfast for you and for your significant other to enjoy compliments of West Boca.